Hello everybody, my name is Dr. Shadi Rafage and I am a board-certified veterinary surgeon. This video is part 2 of our Diseases of the Spleen series. I hope this video adds to your current understanding of this condition in dogs and allows you to make an informed decision regarding your pet's care. Always follow the recommendations of your veterinarian or veterinary specialist closely. Today we will focus on surgical removal of the spleen in dogs. This surgery is called a splenectomy. Unlike in people who may be adversely affected by a complete splenectomy, the majority of canine patients can live normal lives without their spleen. The goals of the splenectomy are to remove the diseased spleen, confirm a diagnosis, and prevent the spleen from rupturing in the future, risking the patient to life-threatening internal bleeding and anemia. It is a far better scenario to perform a splenectomy on a patient who is stable and not in critical condition, as opposed to a patient who is unstable or in critical condition undergoing the same surgery. In fact, those pets that undergo the surgery in the absence of internal bleeding may have an improved survival and easier recovery from anesthesia and surgery. Now, the most common cause for a splenectomy is a splenic tumor that has ruptured. And here you can see what a normal spleen looks like, a spleen with multiple growths, and a ruptured spleen causing internal bleeding. The splenectomy itself can be performed using a variety of techniques. The technique used is dependent on your veterinarian or your veterinary surgeon's experiences and preferences, which surgical instruments they have at their disposal, what they feel is best for your particular patient, and whether surgery is performed on a scheduled or emergency basis. Techniques include manual ligation with surgery material. They can use metal clips. They can use stapling equipment. My own personal favorite is electrothermal bipolar tissue sealing system, which is basically a large handheld cautery device to avoid any kind of implants, metal, or sutures being placed in your pet. Regardless of the technique used, the surgery is considered routine for board-certified veterinary surgeons. Now, during this operation, the remainder of the abdominal organs are evaluated and biopsied or sampled as needed. A liver biopsy is almost always indicated when removing the spleen because splenic cancer, if diagnosed, is usually malignant. And the next question the oncologist is going to ask is whether or not the spleen cancer has spread to the liver. Now, because of the high incidence of malignant splenic disease in dogs, removing the entire spleen is mandatory. Removing only a small portion of the spleen or the portion that's diseased is, for the most part, considered inappropriate. Both the liver and the spleen, as well as any other organs that are sampled at the time of surgery, are submitted to the laboratory for evaluation. Regardless of the technique used, efficient surgical practices and intense anesthetic monitoring are vital to maximizing the success of the operation. Now, surgery can range anywhere between 10 to 15 minutes, all the way up to a half hour to an hour, depending on the surgeon's skill level, how critical your patient is, and how involved the surgery is. Some pets recover very quickly, while others require more time. Some pets remain in the hospital for as little as 1 day. Others can be in the hospital for as many as 4 days, depending on the scenario. Obviously, each scenario is different, depending on how sick your pet is and the veterinary hospitals you have in your area when the emergency occurs. Surgery will usually occur immediately, although some pets require further stabilization before they're able to tolerate anesthesia and surgery safely. Now, after the surgery, the patient will be maintained on IV fluid therapy for rehydration and antibiotics and analgesics in order to maximize the comfort of the pet and success of the surgery. There are a number of complications that occur. The sooner these complications are identified, the better the outcome, as they can be treated quite aggressively. Here is an example of some complications that we can see. Heart arrhythmias or anemia requiring blood transfusions are quite common in pets that undergo this type of procedure. It is impossible to determine which pet will develop which complications after surgery. Therefore, it's important to monitor these pets. And usually they're monitored at a 24-hour emergency facility. Other complications can include low blood pressure, organ failure, strokes, and even death. Depending on what complications arise will determine the treatments which can be used to help treat these pets. They may include fluid therapy, blood transfusions, plasma transfusions, anti-arrhythmia medications, and so forth. Obviously, this type of surgery is one that can involve quite the list of complications and require quite intensive monitoring afterwards. It is not to be taken lightly, even if performed on an elective basis. Therefore, it is most ideal to have the procedure performed at a facility that offers 24-hour intensive care and monitoring. This is to monitor for anesthesia recovery, potential complications, and because this is considered a vascular surgery, and some of the pets undergoing this operation are in critical condition, there are a multitude of possible complications that can occur. Some of these complications, as we mentioned, can also be life-threatening. Now, please check out my next video, part 3, regarding the aftercare involved in those pets undergoing splenectomy and some of the ideas behind the prognosis that they may be associated with this condition. I hope these videos add to your current understanding of the condition in dogs and allows you to make an informed decision regarding your pet's care. Always follow the recommendations of your veterinarian or veterinary specialist closely. Please show your support by subscribing, hitting that like button, and sharing this video with others. This is Dr. Shadi Arafij, and I thank you for watching. Let's take care of our pets. Take care.